Well, I hope you've had a great day. This is Dr. Stephen James, the Senior Special Education Director for Yosemite Valley and Monarch River Charter Schools. Today, I want to talk to you a little bit about a diagnostic assessment versus a formative and or summative assessment. A diagnostic assessment is something that you give a student to find out where their levels are at, like we use the STAR 364. And again, we're trying to verify where exactly that student is in reading, writing, and mathematics. Where a formative assessment is something that you as a parent or even as an educator will look at and say, well, that is a quiz. We're trying to find out something that they know like right this second, maybe something they've covered the day before, or maybe even currently in that course that day. A summative assessment is something that you take at the end of a chapter, the end of a unit, could be looked upon as a final examination. All of those, a student is going to be given a grade in most cases for those assessments. It could be a pass fail, but it could be an A, B, C, D, or an F grade, depending on where they're at in their education and how they're being assessed. But today I really want to talk to you about a diagnostic and the how and the reasons why we use STAR 360. Again, in the special education, it can be very difficult for parents to sit there and watch their children struggle through this assessment. But it is a necessity. We really, truly need to know what that student's actual levels are at. So if they're reading without their accommodations at, say, a kindergarten or first grade level, and they're in second or third grade, we truly need to know that in special education so that we can really understand what supports this child is going to need to eventually be able to read at or above grade level. If we're using the accommodations and it's coming out that they're reading at or above grade level, that data kind of indicates that does this child truly still need special education? Could a 504 plan possibly be a better source for this child or a better program for this child to have? And that is stating that maybe they don't need services any longer. So again, it kind of leaves us in trying to figure out where your child is actually at. So again, it is very difficult. And it's even very difficult for our independent study teachers and for my case managers and just leadership as a whole, because we're watching this child truly struggle through something, and you can see how it pains them. But again, as educators, we really need to know this data. We really need to know where they're at. And if we can't figure this piece out, we're never going to be able to identify the proper goals, the proper services, the amount of services that this child is going to need to get them over the top, and where they are actually reading, writing, and doing mathematics at grade level, eventually without those accommodations, so they're at where their peers are when it comes to their current grade level and their opportunities for them later on in life. So again, we know this is going to be a struggle. We know it's not going to be easy, but we really need this struggle to happen. And when we look at this, we're really talking about our mild, moderate kids, our mild, severe kids. We do want them to take, the STAR 360, but if we have other alternatives, we can. But our mild, moderate students really, truly need to be taking the STAR 360. There could be some other form of diagnostic we use in the future, but currently the STAR 360 is where it's at, and this data is so important. So again, I want to thank you for your time. Again, I'm Dr. Stephen James. I'm the Senior Special Education Director for Yosemite Valley and Monarch River Charter Schools. Again, thank you and have a great evening.